Hi everybody, and welcome back to Rebellious Menstruation. This one is going to be about menstrual pain. This is a Q&A that I was asked to do about menstrual pain, which is essentially called dysmenorrhea. Which means painful menstruation or period cramps. This can happen from just before or up to a year before your first actual period, also known as menarche. So pain without a primary cause, or essentially pain caused from actually having your menstrual cycle, is called primary dysmenorrhea. Pain with reproductive disorders such as endometriosis, endometriosis and fibroids is called secondary dysmenorrhea, because there is another reason why you're getting that pain. Primary treatment options for both include pain relief medication, both over-the-counter and prescription, anti-inflammatory medication, hormonal and oral combined pill contraceptive, heat like a heat pack or hot water bottle, regular exercise and relaxation techniques. For secondary dysmenorrhea, full hysterectomy is often used. For primary dysmenorrhea, the uterine lining produces prostaglandins, which is a hormone-like substance, and this causes the uterine muscles to contract strongly, and this is what is causing the pain. There are different types of prostaglandins which are produced throughout the body. However, specifically the F2X prostaglandin is what is responsible for the period cramping. Manifested pain can be in the lower back and abdomen, and can be both a constant ache or a pulsating type ache. Okay, we keep going. Typically the pain can start up to 24 hours before your period starts and continue the duration of your period. Menstrual blood can be a mixture of blood, clots and uterine lining. This pain can include headaches, nausea, vomiting, digestive problems, both diarrhea and or constipation, as well as fainting, tender breasts, swollen abdomen, and it can be worse in the first 24 hours as well as and include the pre-24 hours. Endometriosis is the cells lining the uterus. It move to other areas outside of the pelvis and behave abnormally, and this causes severe pain. On average, it can take up to 10 years for diagnosis, due to period pain being considered a normal facet of periods. Fibroids are benign tumours made of muscle and tissue and can grow inside the uterus and are thought to be connected to sex hormones. Mostly are considered to be asymptomatic, or which basically means to cause no symptoms. Endomyosis is the presence of endometrial cells growing in the muscle layers of the uterus, and is very difficult to diagnose and treat because women's pain isn't taken seriously. The treatments of these secondary dysmenorrhea are difficult as the underlying condition is not fully known, and on top of that, contraceptives mask the issue, but contraceptives do not treat, fix or change any of these types of things. They simply put a mask over the top of it. Surgery and hysterectomies are the same. They provide relief but are not effective for treatment, and can often mask serious causes behind these secondary dysmenorrhea. Approximately 10% of women are debilitated by period pain. However, there are certain circumstances when medical help should be sought. If sudden changes in pain, duration, type and style of pain, then what is usual for yourself. So one of these is that bleeding fills a super tampon cup or pad in under an hour. Signs of infection, fever, chills, body and aches. These are symptoms of both TSS and uterus infection. These symptoms and potentially pregnancy, you should seek medical attention. You should attend the ER if you faint, or if you have severe dizziness, intense or sudden pelvic pain, thick and heavy tissue is passed frequently and regularly, and that this tissue is or could appear to be silverish or greyish in colour. Keep in mind that it is always important to keep effective records as possible in regards to all of your menstruation, because when approaching medical staff, be it either your GP or the ER, records such as the timing of cramps, type and location of period pain, recent changes in these pain, cramps and periods, dates of your last couple of periods and the length of them. If you have regular or irregular periods, what, when, and what, when, how, with the colour of your vaginal discharge, as discussed in a different video. Discharge is a sign of health or ill health, and discharge for over the entire cycle as well. If you have painful intercourse at any point, and if you suffer from infertility or could possibly be pregnant, or are attempting to get pregnant. If you have a history of pelvic infections, UTIs, the age of your first period, and any medication that you are currently taking and how long, or if you are still currently on the pill. So if you have a record of all of these activities to present to your GP or doctor, in one of my other videos I went over the app that I actually use to track and record my period and put notes in. I definitely would recommend this, because if anything goes wrong, I now have a historical record of what is going on with my period. So on top of that, that is where you should either go to a GP for any of those reasons, or your ER. If ibuprofen or pain medication does not, over-the-counter pain medication, there are alternatives like prescription medication, or there is also acupuncture and electronic interruptions of the pain signals, like the Livia. So you can wear the Livia on your stomach. I will link their website down below so you can go have a look for yourself, as well as lifestyle choices, which are maintaining a healthy body weight, eating moderately and avoiding excess sugar, because the excess sugar is causing massive mood swings. So no matter what you've heard traditionally, if people keep on giving you chocolate, try as much as you can to avoid it, because that type of sugar while on your period is exceptionally bad. And also exercising moderately, not smoking, and are reduced to low to no alcohol intake, because it is very hard to define what normal period pain is, and over the pain medication is usually effective, as is gentle exercise like walking and stretching. And while hormonal birth control absolutely masks period pain, so most people are deluded into thinking that it reduces their period pain, it has radical other effects on your body and your psyche and your mental health. So just be aware of the pill being used to regulate periods, because that's not really what it does. So your period pain is personal to you and shouldn't necessarily be compared to anybody else and anybody else's experience, because that's not necessarily the true and accurate representation of how you are dealing with it and what is happening with you. So seek medical advice if you feel that something's wrong, because more intimately you're the one who is having to deal with it and live through it. One of the best pieces of advice that I saw, I think I read it in a Tumblr comment, was every time a doctor refuses to take your pain seriously, request that they document in your notes that they are refusing to treat you based on your symptoms, and you'd be surprised about how many of them change their tune. So at every point where they're refused service, absolutely request that they document and note in your notes that they are refusing to take your pain seriously. So, but that is also what the comment was with keeping track of your periods and symptoms, is that you can then present that information and you have a far more accurate record that you've taken at the time, rather than when you think back and go, oh, I think my last period was quite heavy, or I think I was pain last period. No, write it down, document it, keep a journal, keep an app, keep something that you can actually then present to the medical professional and say, this is what's been happening over the past 6 months, year, 12 months. I've been having that app since 2013. So it is currently January 2019. So, that's 5 years of historical periods and historical data that I have to track and keep and can take to my doctor. So if anything starts going a little bit hazy, so you need to take responsibility for the health that you have, because your pain is subjective to you. Anyway, the usual things apply. My contact details are down below. I will link the Livia website for electronic pain management, and you can always leave a comment below. Outside of that, enjoy the rest of your day. Bye.